Good morning, everyone. My name is Jennifer De La Cruz, and my presentation is on why physicians should be allowed to assist with patient suicide. Is state law that prohibits patient-assisted suicide unlawful? According to the Supreme Court, they are not illegal. Does that mean that physician-assisted suicide is a crime across the United States? Authorization of physician-assisted suicide in America is dependent on state legislation. However, the present study suggests that physician-assisted suicide should be legalized across the land. Patient demands. Although opponents of the practice argue that authorizing physician-assisted suicide will leave the physicians with no choice but to comply, that is not the case. There are many services physicians can offer patients while upholding professional ethics and personal beliefs. Practices for physician-assisted suicide, like withholding treatment, CPR, or nutrition at the patient's request, are within the professional practice of medicine. According to Angle, medicine is founded on the ethical principle of patient autonomy. When physicians are confronted with conflicting ethical and professional guidelines, patients' autonomy should take precedence. When patients are aware of the nature and consequences of their requests, Angle argues that physicians should be allowed to comply with them. Physician advocacy role. How should physicians respond to patients' requests to assist in dying? Physicians are better positioned to determine a patient's diagnosis, disease, prognosis, and treatment options. Practices like preparing patients for dying, providing the means, and supporting administration of drugs are in violation of AMA codes. However, physicians have a responsibility to ethically practice medicine. This should include practice that uphold humane care. Physicians are responsible for determining how to care and respond to patients' demand, especially terminally ill patients who wish to die using medical professionals' help. Legalizing physician-assisted suicide means that there will be guidelines and practices for healthcare professionals to legally and ethically respond to such patients. When such guidelines are absent, there is a high likelihood for unethical behavior when physicians are trying to advocate for the patient's best interests. Lack of palliative care. Treatment at the end of life care is harmful in some instances. Patients are drained physically, financially, and emotionally. Patients receive unnecessary care or no care at all sometimes. There are no principles and practices of hospice and palliative care that fulfill all patients' requirements. There are extensive barriers to palliative and hospice care in the United States, for instance, cost. It is imperative that physicians do not perform futile care. Death sometimes is in the patient's best interest. In times when patients will suffer until death, patient-assisted suicide is a moral good. In instances when the physician can warrant the patient's request, they should assist patients to commit suicide to accelerate death and relieve unnecessary suffering. Giving patients the rights to die in a way to respect their autonomy and alleviate their suffering, allowing them to die with dignity. Thank you.